Welcome to today's session. I hope you were well. In today's session, I want to build on what we discussed and start the process of bringing to a close what we began 28 sessions ago. So far, we have covered 28 sessions with regards to depression, how to understand it, how to alleviate the pain and suffering, and how to overcome and conquer depression. I began the series by explaining a simple concept, which is that in order to treat a person, you have to think about how you treat holistically the whole person. And I use the analogy that we are spiritual beings, we live in a physical body, we have an intellect, and in that intellect, our emotional state is regulated by how we use our intellectual faculties. I began with the physical side, recognizing that it serves as a building block for the mental and the psychological, and then afterwards the spiritual side. I think in about 3 sessions from to this particular session, I will bring the physical side to a useful place of rest, and then we can move up to the next phase. In any case, in the session I covered previously, the 2 prior sessions, I made reference to anxiety about the past and anxiety about the future. The whole point was that most people have a level of anxiety, both with regards to their past and especially with regards to their future. And this creates a huge psychological, physiological demand on their bodies. And for that reason, there is so much suffering, sometimes needless suffering. And so in today's session, I want to talk about something that I call a checklist. I should preface it first. Many, many years ago, I think we must even go back as far as 1967, 1965. There was a plane crash. It was a Boeing plane, B-17. The crash, the 2 pilots died. As part of the assessment post the crash, people were trying to understand what went wrong, what was the issue. And what they found was that there were certain safety procedures that were missed by both pilots. We began that year and the year that followed with the advent of something called the checklist system. So most people are aware of when people say, "Can I see a checklist?" It began from the aviation industry in what we see today. Obviously things have occurred at some level, but it became more popularized after that plane crash. A checklist was prepared, and therefore what we have seen over many, many decades is a reduction in the number of casualties and fatalities and plane crashes. Because before a pilot takes the flight, there's a checklist that he has to or she has to go through, and that checklist is to ensure that you've gone through the safety processes. Now, it's really no different with regards to conquering depression or anxiety. Part of the reason I began with the physical side, and part of the reason I focused on the importance of energy delivery, energy generation, and energy use or waste, is partly because you need a checklist. And there is no need jump into the mental, physiological, psychological aspect if you haven't ticked the checklists with regards to the physical side. If you're starting any process with regards to healing depression, or even with regards to anxiety, the starting point to prevent and to treat any form of anxiety-related suffering or any form of depression-related suffering is exactly the same as you would if you were treating any disease. It starts with the basics. We know that all diagnosis is hypothesis. You start by hypothesizing what you possibly think the issue is. And you go through a checklist. You test for A, you test for B, you test for C, and through the process of elimination, you eliminate things that are not necessarily causally linked, although there is a correlation. But you start with the basics. Unfortunately, with regards to depression and anxiety, we've come to expect that there is a silver bullet. There's a silver bullet in the form of a drug that we would take, and it takes away all of our suffering, and depression goes away, and the pain and anxiety and worry and fear and doubt disappears. In the short term, such a drug has been produced by Big Pharma. It's done more harm, in my opinion, than good. Not because it doesn't have a place, it does, but it's been prescribed at a level far beyond what most, you might say, logical people would consider to be the scientific method, which is to start with the process of elimination, start with a hypothesis, go down to root cause, and then start the treatment regime. You don't just prescribe. Prescription has a place, but if you're treating holistically, you always begin with the process of being inquisitive and curious and fault finding and searching. Now, this is partly because we have a Western media, and the propaganda from the Western media has been very, very influential, but it's done us a lot of harm. We've been told in many ways things that we've known to be true since time immemorial. We've been told that they are bad for us, one of which is food. The starting points to solving and healing your depression and your anxiety, if you begin at the physical level, is to understand the whole concept of energy delivery, and that starts with your diet. Now, in the series that I've covered so far, I hope you have seen and heard me talk about the importance of recognizing that there are two fuels that you can use to fuel your body: glucose or ketones. And the source of such, you might say, food either comes from sugars and carbohydrates or comes from fat primarily and fiber. The PK diet, the paleo-ketogenic diet, therefore, in my opinion, is the starting point. If you're suffering from anxiety and depression, irrespective of age, young, middle-aged, old, start with your diet. And the PK diet is the place to start. Yes, we have heard from the media, and we've been scared into believing that whenever you say high fats, people should be panicking about the risk of high cholesterol. Unfortunately, what we've not been told is that a PK diet done correctly extends the quality and the quantity of our life. And high fat is essential. It's essential for the optimal functioning of the human body. It is a raw material and a very essential raw material for healing and repair, but also for your immunological requirements for the brain. I made reference in the sessions that covered previously about mitochondria and how the actual fuel for mitochondria, the best fuel, is fats, ketones. And so in thinking about the checklist, recognizing all that has been covered so far in 28 sessions, I would like you to think about a checklist that you can pull together and make a note of the various parts of what has perhaps resonated with you. But keep that in mind with respect to two things. Number one would be you are what you eat, and therefore your diet matters. In the session that follows, I'm going to explain and consolidate what I eat. The essence is not to make you follow my own pathway, but rather than the conclusion to this section be a prescriptive session, I want it to be a descriptive session. You can take what I'm doing and then you can critique it. It's much easier than me telling you what to do. I'll describe ways that I have made alterations to how I eat and what I eat, the timing of when I eat, the frequency, the intensity of how I eat, and how those changes are primarily to get me back in line with how things should function. So the first will actually be what we've covered so far, which are the interventions that we should be focused on: diet, supplements, lifestyle, exercise, nutrition, rest, detox. Those should be on your checklist. And now the other part of the checklist should be blood tests. I haven't, and perhaps I should have, provided a copy of my blood tests sample, not to show you particularly, but just to illustrate A few years ago, I would have been completely ignorant about my body and who I am and how it functions. I always deferred to the professionals. For most people, it's a very, very bad strategy. You should be your own doctor in a way, because you actually have and pay the highest price for all of your suffering. Walking into a doctor's office and being offered 15 minutes or less for a doctor to diagnose things that have been occurring to you over a long time, recognizing the pressures that doctors have, especially in the UK, is perhaps not the best approach. And if you understand yourself better, you can explain to a doctor what the issue is. I find it very fascinating. You walk into a doctor's office, and here is this professional who is supposed to be very competent. And the first question they ask you, like any mechanic, like any third party, is what is the issue? What is the problem? What has been your observation? What have you recorded and are you reporting? And based on what you tell them, they go on a fact-finding mission. They ask you more questions and they try to pull together this process of diagnosing what the issue might be. The problem is we don't have healthcare like we used to, and therefore doctors cannot spend a lot of time with you. Gone are the days, especially in cities, where we have family doctors. Except you live in a small village or you have a private doctor, you do not have someone who is monitoring and keeping information about your health over years. And so you have a short window of time to gather your thoughts and your emotions and your concerns, to present it in a very, very articulate way with the right emotions and the right focus points, and then a short time for the doctor to say, I understand what you've described. Let me now hypothesize in my mind and go through the various clinical steps to come up with a diagnosis. Short time, a very short time, doesn't allow all of that process. 15 minutes is not a long time. And so it's important for you to take your matters into your own hand and recognize that you become your own doctor. Not from the perspective of self-healing, but from the perspective of taking matters into your hand. And this requires simply study. I made reference to all of human suffering stems from ignorance. You have to study how the physiology of the body works. What are the various systems of the body? What are the various types of doctors? And if I had an issue with a part of my body, who would I need to see? We talked about thyroid, your adrenals. Who would I have to see? Your endocrinologist. Who would I have to go and see? Your general practitioner. There are several doctors with several specializations. And therefore, to know who you should see, rather than go to your general practitioner, who then tells you who you should go to, if you understand, and if you have done a blood test, you're then exposed to new vocabularies and words that allow you to do more research. You find out more about your liver, your kidney, your heart, and the other parts of your body. And that allows you to ask questions rather than just accept what you were given. So as I bring today's session to a close, let me remind you about the importance of a checklist. It's your life. If you are suffering, take some time. Go back in the sessions that I have covered and just make a list of the things that you perhaps resonated with you, and create a checklist. And in that checklist should be your blood test. Now, I should also say, I think this is very important. As part of my study, I found that I had to take matters into my own hand, and so I went private, and I would do a private test for my blood, receive the test so I could understand it. Primarily because some of the tests done by the NHS are not always completely inclusive of all tests. You need a full picture. If you're suffering from thyroid, when it's hypothyroidism, you might find actually that the NHS test, the typical basic test, is not inclusive of the various aspects of the thyroid testing. They might give you your TSH, but they may not do a test for your T30 or your T4. So it's important to do it privately and get the information. An important part of what I think is necessary is to keep in mind that there is a range of results, a reference range provided, whether by the NHS or in any country in the world. In any case, that range, that reference range, which is where people say you fall within a range of 10 and 15, or 10 and 12, and therefore you're fine. That range represents 90% of the population. And in the West, the fact that we've become very unhealthy, that range has been changing since the 1940s and 30s. And therefore what you will find is the range you were given doesn't necessarily mean you are healthy. It's effectively a range relative to other people in the population. In the UK, about 80% of people, most people, are overweight and obese. Keep that in mind. And that simply means it skews the distribution. The healthy people, the very healthy people, are not in that distribution. They're outliers. And therefore, you must make sure to keep in mind that the reference range you get for your test results do not reflect the ideal reference range that you should be focusing on. That requires more study. I hope today's session has been useful.